Why are MRI scans for muscular dystrophy so expensive? Have you ever wondered why MRI scans for muscular dystrophy come with such a hefty price tag? Let's break it down. First, the technology behind magnetic resonance imaging is quite advanced. MRI machines are expensive to buy, maintain, and operate. They use strong magnetic fields and radio waves to create detailed images of muscle tissue. This requires sophisticated hardware and software that adds to the overall cost. When it comes to muscular dystrophy, the imaging techniques used are specialized. For example, T1 weighted and T2 weighted sequences, as well as stir sequences and quantitative muscle MRI, are employed. These techniques help detect subtle changes in muscle, such as inflammation, edema, fatty infiltration, and muscle atrophy. The complexity of these imaging sequences means they take more time to perform and requiring expert radiologists who are trained in neuromuscular disorders to interpret the results accurately. This expertise also drives up costs. Additionally, MRI scans for muscular dystrophy often involve quantitative assessments. These assessments track disease progression and treatment responses over time. For instance, measuring muscle fat replacement and inflammation are critical for understanding muscle damage. This detailed analysis requires sophisticated software and additional processing time, which contributes to the higher costs compared to standard MRI scans. Another factor is that muscular dystrophy is a rare and complex condition. As a result, MRI scans are typically conducted in specialized centers that have multidisciplinary teams. These teams often include neurologists, radiologists, and other specialists who work together to provide comprehensive care. The coordination among these experts adds to the overall expense of the scans. Finally, the healthcare system plays a role in the cost of MRI scans. Factors such as insurance reimbursement rates, hospital fees, and geographic location can all influence how much a patient pays for these scans. In summary, the high cost of MRI scans for muscular dystrophy is due to the advanced technology, specialized imaging protocols, expert interpretation, and the clinical resources required. These scans are essential tools that help non-invasively reveal muscle pathology and guide treatment decisions, justifying their expense in managing this progressive muscle disease. If you have questions about MRI scans or muscular dystrophy, it's always best to consult with a healthcare professional for personalized advice.